Hello and welcome to the Northern Cancer Alliance Immunotherapy Pre-Assessment. To help answer some of your questions and to understand what to expect throughout your treatment, we have created these films. There are 5 chapters to the film and we'll be covering these topics. What is immunotherapy? What you can expect on the day? Side effects? Emergencies? What happens after immunotherapy? You'll have time to individually discuss any questions with the nurses here. The films will also be available to watch again at home. You can show these to any of the relatives, carers or friends who are not here with you today, and they might find this helpful so they can understand your treatment. Let me introduce you to the team who are now going to take you through the rest of the film.
Our immune system works to protect our body from infection, illness and disease. Immunotherapy uses your immune system to help fight cancer cells. Cancer might develop when the immune system recognizes cancer cells but isn't strong enough to kill the cancer cells. The cancer cells produce signals that stop the immune system from attacking it. The cancer cells hide or escape from the immune system. There are a number of different types of immunotherapies, and they work in different ways to help our immune system recognize and attack those cancer cells. However, immunotherapy can cause inflammatory and autoimmune problems, which is where the immune system is on overdrive and starts attacking its own cells. This causes a wide range of side effects, which we will discuss later in the film. Normally, immunotherapy is split into cycles, which allows your body to recover between treatments. This rest period usually lasts between 1 to 4 weeks. How often you receive immunotherapy will have been discussed with you when setting out your treatment plan. Your cancer doctor will decide what treatment you receive based on years of research, as well as how fit you are. Sometimes single immunotherapy drugs are given alone, or they can be given in combination, depending on the type of cancer you have and your treatment plan. How your treatment will be given will depend on which drugs you will receive. The most common way to give immunotherapy is intravenously, through a drip. However, it can also be given in tablet form or through an injection. We ask that 2 to 5 days before your immunotherapy appointments, you get some blood tests. This is because immunotherapy can affect your blood and your blood count, and sometimes your body needs extra time to recover before we can give you your next dose. You may receive a phone call prior to treatment so that the nursing team are able to ensure that you are well enough for your treatment. They will also check your blood test results to ensure that they are satisfactory. This will allow the pharmacy to prepare your treatment ahead of you arriving to the unit. We will give you the information today about which blood tests need to be taken. You can choose to have your bloods taken at the hospital, a local phlebotomy clinic, or some GP practices may even offer this service. Please take your information with you to each appointment to ensure the correct blood tests are taken. Please remember that not having your bloods checked before treatment can cause long delays on the day of the treatment. So please let us know if you're having problems booking an appointment for your blood test.
On the day of treatment, please bring with you your usual medications and take them as normal. Your doctor will tell you if you needed to stop taking any of your medication before your treatment started. However, do let us know if you're on any blood thinning medication. You can also bring in with you any drinks or snacks you would like. We also recommend you bring something to keep you entertained. This could be a book, an iPad or a tablet, as some treatments may take several hours. Please arrive at your appointment on time and check in at the desk. We aim to bring you into the unit for your appointment time, but please be aware that due to the nature of anti-cancer treatments, we can unfortunately experience delays when providing care for potentially unwell patients. The nurse in charge will endeavour to keep you updated if there is a delay on the unit. When you're brought into the unit, your nurse will check your weight to make sure we have the correct dose of treatment for you. The nurse will then check your observations, including blood pressure, oxygen levels, and heart rate. Your nurse will then complete a full assessment with you prior to commencing your treatment. During this assessment, they'll ask how you're feeling today and how you've been feeling since your last treatment. This gives you an opportunity to let us know about any problems which you may be experiencing, or if there's anything you're concerned about. Now, it is important to be honest with your nurse, as they can help manage any side effects that you may be experiencing. The nurse will also be checking the results of the blood tests you had before your treatment. If your nurse identifies any issues with how you've been managing since your last treatment, or with your blood test results, try not to worry. It's likely to be something we can help you to manage, but could mean that there needs to be a pause in your treatment or a reduction in the dose which you receive. Allowing side effects to go unmanaged can increase the length of time which you have these side effects, and some may be permanent. Treatment may need to be discontinued permanently if you go on to develop serious, harmful side effects. You'll also be given a telephone number which is available to call 24 hours a day if you're feeling unwell in between treatments. If you're having intravenous treatment, a nurse will then place a needle into your hand called a cannula for the treatment to be given through. This is a relatively straightforward procedure and shouldn't be too painful. We place the cannula into the back of your hand if possible so that we can keep a close eye on it. This is to make sure that the treatment does not leak out of the vein, as this can cause discomfort and damage the skin. This is called an extravasation. This can be very serious, and you must inform a member of staff immediately if you notice pain during your infusion or swelling around the site of the cannula. You may be advised to have a central line inserted prior to your treatment. This may be recommended if it's difficult to access your veins, or if you're having immunotherapy which needs to be given via a central line. Depending on the immunotherapy regime you are having, we may then give you medicine that could help manage symptoms, make the immunotherapy work better, or reduce the risk of an allergic reaction before starting the treatment. Following this, your immunotherapy will be given. Some people do not have intravenous immunotherapy and may have an injection or receive some immunotherapy tablets instead. Depending on your immunotherapy regime, you may then be given medicines to take home to again help manage side effects. Your nurse will explain how to take these medicines.
Different immunotherapy drugs may have different side effects. However, there are some side effects which are more common than others. In this chapter, we'll discuss the most common side effects and give you some advice about how these can be managed. It's important to be aware that these side effects can occur up to 12 months after finishing immunotherapy, and some side effects can be permanent.
If there are any specific side effects to the treatment that you will be receiving, we will discuss this after the film.
Immunotherapy can cause autoimmune and inflammatory complications, which you should be aware of. This is why we test your blood before every treatment, as sometimes your organs can be affected without any obvious side effects. Fatigue is a common side effect of immunotherapy. It is a feeling of tiredness or exhaustion. This can be caused by the treatment or by the cancer itself.
Fatigue can be managed, and in most instances, fatigue will improve following the end of treatment. Here are some handy tips on how to manage fatigue. Keeping active usually helps to increase your appetite, gives you more energy, and also helps you to sleep better. It could be useful to set yourself some goals, no matter how big or small. For example, completing a lap of your garden or taking the stairs where possible. Eating well helps you to maintain a healthy weight, which can give you energy and increase your ability to carry out day-to-day tasks. If you feel like your fatigue is becoming unmanageable, please discuss this with your nurse on the day unit or call the alert helpline.
Bowel changes are a common side effect of immunotherapy. If diarrhea is commonly associated with your type of immunotherapy, we may give you some anti-diarrhea tablets to take at home.
However, loose stools can sometimes indicate that you have an infection, and we may need to take a stool sample to exclude this.
Occasionally, immunotherapy patients can experience severe diarrhea. This may happen with blood or mucus in the stool and abdominal pain. This is called immunotherapy-induced colitis, and in some cases it can be life-threatening. Colitis is best treated early, so call an emergency helpline immediately if you develop any of the symptoms discussed. You may need intravenous fluids to replace the fluid you have lost, and you may also be given a course of steroids.
Some patients may also develop constipation, which may or may not be accompanied with abdominal pain. If you are passing stool less often than normal, call the emergency helpline. Your doctor may be able to prescribe some medications to help.
Skin changes are a common side effect of immunotherapy. Some patients may develop a rash on any part of the body or may have itchy or dry skin. Please tell us if you are experiencing skin changes, as your doctor may be able to prescribe some medications and creams to help.
It's important to look after your skin throughout your cancer treatment. Use any medications and creams as prescribed, and protect your skin from the sun by using a high SPF sun cream and wearing a hat to protect your head. It's also advised to avoid spending prolonged periods of time in the sun.
Immunotherapy can sometimes cause the lung tissue to become inflamed. This is called pneumonitis, and it can be life-threatening. Signs and symptoms may include feeling more short of breath than usual, experiencing chest pain, particularly when breathing in, a new cough or a fever. If you're experiencing any of these symptoms, you may need to come into hospital and have treatment with steroids and/or antibiotics. Pneumonitis is best treated early, so call the emergency helpline immediately if you develop any of the symptoms. Immunotherapy can cause autoimmune problems, which is where the immune system is on overdrive and starts attacking its own cells. This can commonly affect the thyroid, a butterfly-shaped gland in the neck. If the thyroid is affected by treatment, it will usually become underactive, which means it's not producing enough hormones. Common side effects include fatigue, weight gain, and low mood. We will monitor your thyroid levels throughout your immunotherapy treatment so we can identify these changes. Treatment for an underactive thyroid involves taking daily hormone replacement tablets. If you are started on this medication, you will need regular blood tests to make sure you are receiving the correct dose. Treatment may be lifelong, or thyroid function can improve after immunotherapy finishes.
Cancer and its treatments can change your body and appearance. Some treatments may affect your skin and nails. Changes to how you view your body might lead to feelings of less self-worth, feeling unhappy or feeling uncomfortable. Most of these changes are likely to be temporary, such as weight loss or gain. However, some changes throughout your cancer journey, for example surgical scars, are permanent. This also includes changes which aren't always visible to others. There are ways to help you to manage your body changes and to help improve your confidence. Please speak to your nurse who can help you with this. They can give you support and tell you about other helpful resources. You will need time to recover from treatment and to adapt to body changes, especially if they're permanent. So, make sure that you regularly take time out to do nice things for yourself. This could just be having a relaxing bath or spending time with loved ones. Your diagnosis and treatment may have an impact on your sex life. This may be due to physical reasons such as tiredness or for emotional reasons. There can be ways to improve your sexual well-being and to manage any problems, but sometimes this gets forgotten because there are other things to cope with when you have cancer. It may also be ignored because you feel embarrassed or worried when talking about sex. Please feel able to ask any questions to your team throughout your cancer treatment. It's perfectly normal for people to worry about having safe sex following cancer diagnosis and treatment. Please remember that you are not able to pass cancer on to your partner during sex. However, it is also important to use barrier methods like condoms and cervical caps, as small amounts of immunotherapy may be in your bodily fluids. A new cancer diagnosis can be tough for both you and your surrounding friends and family. There are lots of ways to receive emotional support through your immunotherapy treatment. It is a frightening time and you may worry how immunotherapy will affect your current lifestyle. The nurses are available on the days of treatment to discuss any concerns you may have and are able to signpost you in the right direction to receive the support you need. There are a number of charities available which provide support during cancer diagnosis and treatment. The Cancer Care Map is a simple online resource that aims to help you find cancer support services in your local area. Please ask your nurse for further details.
Emergencies can sound scary, but it's an important thing to discuss, just in case. There are some potential side effects of immunotherapy that could result in a medical emergency, and it is important that you seek medical advice immediately in these circumstances. It is important, if you're experiencing any of the side effects on the screen, that you contact the helpline as soon as possible. These side effects may be the start of a serious problem associated with immunotherapy treatments. Diarrhea, abdominal pain, blood and mucus in the stool, headache, increasing breathlessness, visual disturbances, behavioural changes, pins and needles or numbness. Passing less urine, fatigue, skin rash, muscle weakness, lightheadedness or low blood pressure. Depending on the type of cancer you have and the treatment you receive, you may be at an increased risk of developing an infection. We advise that all patients receiving immunotherapy check their temperature if they are feeling unwell and look out for any temperature spikes. A spike is when your temperature goes above 37.5 degrees. It can be dangerous and a potential sign of life-threatening infection, also known as sepsis. If your temperature does spike at home, or you feel shivery or flu-like, then please ring our 24-hour emergency helpline immediately. We will be able to assess your symptoms over the phone and provide the best advice for what steps to take next. If you require medical attention, we'll advise you where to go based on your location and what you need. We suggest that you minimise the risk of catching any infections by avoiding crowded areas, busy public transport or supermarkets. It is important to maintain good personal hygiene and carry out effective hand washing where possible, as well as avoiding unwell friends and family members. During cancer treatment, you're at an increased risk of developing a blood clot. They usually develop in the leg and are known as deep vein thrombosis, or in the lungs, which are known as pulmonary emboli. A deep vein thrombosis is the most common type of clot. The most usual and sometimes only sign is leg pain. Other symptoms of a blood clot in the leg include a red, swollen or hot to touch leg. Although less common, clots can also present in the arms, especially if you have a central line in place. Clots in the lungs may present with a new cough, shortness of breath, coughing up blood and pain in the chest, particularly when breathing in. Feeling dizzy, lightheaded or blacking out can also be a sign of a lung clot. If you notice any of these symptoms or if you are concerned, it is important to phone the alert helpline so that we can carry out the right investigations and start effective treatment. To help prevent blood clots, it is important to try and keep active, not sit for prolonged periods of time without moving, and to maintain a healthy weight. Quitting smoking also reduces your risk of developing a clot. Sometimes we give treatment called anticoagulation to help prevent blood clots. This is often in the form of a daily injection. If your team thinks you may be at a high risk of a blood clot, they may suggest that you take a small dose of anticoagulation throughout your treatment to help prevent blood clots. If you have had a blood clot in the past, or you know that you're at a higher risk, please let your team know. Some other emergencies will require immediate medical intervention. So please remember that if you or your relative is having immunotherapy and becomes unwell at home quickly or experiences any severe chest pain, then please phone 999 and ask for an ambulance.
I've been through cancer treatment, so I know the end of treatment can be a challenging time. Sometimes people finish immunotherapy and may not need any more cancer treatment. Other times they may still require other treatments, such as surgery or radiotherapy. Sometimes people might be restarted on a different immunotherapy or other treatments, as this treatment was to help manage the cancer over a period of time. Usually, following the end of treatment, you will have a scan to check how the cancer has responded to immunotherapy. You should then attend a review with your consultant, where you will discuss the next steps. You might still have side effects following your treatment, and it may be several months before you start feeling like your new normal self. Some side effects might be permanent, and we can give you advice on managing these at home. If you become unwell after treatment has ended, we still advise you to use our alert helpline up to 12 months after finishing immunotherapy. However, this may vary depending on the type of cancer you have, so please follow the advice of your consultant. You will also have a specialist nurse who you can contact for advice. Often, people go from having lots of appointments and input from cancer specialists to much fewer. This can cause feelings of stress and anxiety and is normal. You might also be anxious about other things, for example, returning to work. You are still able to access support services and will still have a point of contact following treatment. The Cancer Care Map is a simple online resource that aims to help you find cancer support services in your local area.
We hope you found this helpful and we wish you all the best with your treatment. Please take the opportunity now to ask the nurses any questions that you may have.